Today, we're diving into a really massive shift that's happening in healthcare, and it's being led by the Veterans Health Administration. You see, they're moving away from a system that just treats diseases to one that's actually designed to help veterans live their absolute fullest lives. So let's get into it. Okay, this quote right here, this is the heart of the entire revolution. This simple shift in language, from focusing on what's wrong to focusing on a person's life and their purpose, it literally changes everything about the patient's journey. And this slide just lays it all out perfectly. On the left, you've got the old way of doing things, disease-driven care. Think of it as reactive. It only really kicks in when something's already gone wrong. But on the right, you've got the new vision, patient-driven care. This is proactive, it's personal, and it's built around what an individual veteran actually wants out of their life. So you might be wondering, why was this massive change so necessary? What was the problem that demanded such a complete rethinking of how we do veteran care? Well, the Institute of Medicine put it pretty bluntly. They called the traditional U.S. health system a disease-driven approach. It was often confusing, fragmented, felt really impersonal, and wow, was it expensive? And the result? You got disappointing outcomes, especially for chronic conditions that affect so many veterans. The system just wasn't built for long-term well-being. So in the face of this crisis, the VHA didn't just try to patch things up. Nope, they developed a whole new philosophy. It's a complete pivot, built on a new set of principles designed to tackle the shortcomings of that old model head-on. And make no mistake, this wasn't just some suggestion in a memo. This became the VHA's #1 strategic priority. The mission right here was crystal clear: to provide a new kind of healthcare, one that is personalized, proactive, and fundamentally patient-driven. So how does this new approach actually work? Well, it's built on 3 really powerful pillars. First up, personalized. This means your care isn't a one-size-fits-all deal. It's tailored to your specific conditions, your life, and what you value. Second, proactive. The system doesn't just wait for you to get sick. It actively works with you to keep you well. And third, and this is the big one, patient-driven. Your care plan is based entirely on what truly matters to you. Now, a new philosophy is great, but how do you actually put it into practice? To do that, the VHA developed this powerful visual tool. It's called the Circle of Whole Health, and it really acts as a brand new map for understanding a person's entire well-being. And here it is. What I find so fascinating about this is how it completely reframes the whole idea of health. It's not just a list of symptoms or diagnoses. Instead, it puts the veteran, the person, right smack in the center, surrounded by all the things that actually contribute to their life and their health. Everything starts at the core with me and mindful awareness. This is the foundation. It's about being conscious of your current state, your stress levels, your pain, your energy, because that awareness is what empowers you to shift from just reacting to problems to proactively managing your own health. Then you move out to the next layer, this green circle, self-care. This is all about the everyday choices that have a huge impact on our health. You know, the food we eat, how well we sleep, our relationships, our personal growth. It's basically all the things we have direct control over. And finally, the outer blue circles bring in professional care and community. This is where you find conventional medicine, all the tests and treatments. But it also, very importantly, makes room for complementary approaches like acupuncture and massage. And crucially, it recognizes the vital role that our community, our family, our friends, our social connections plays in our overall health. Okay, so here's the crucial part. This isn't just a poster on a wall. This isn't just a theory. The VHA is actively rolling this out across the country. Let's take a look at what this change actually looks like in the real world. And this is where the theory becomes real. And it's pretty cool. We're seeing things like demonstration kitchens and gardening programs in New Jersey. In Los Angeles, veterans are using Tai Chi and mindfulness to help with pain and substance abuse. Washington, D.C. has launched virtual wellness clinics to make care more accessible. These are real, tangible, innovative programs that are changing lives right now. And if you need proof that this is a real shift, just look at the data. Let's take just one area, chiropractic care. The number of veterans using these services literally skyrocketed from around 4,000 to over 26,000 in less than a decade. I mean, that's a huge sign that the system is really embracing a more holistic, integrative approach. of course, you can't have a new model of care without getting the entire workforce on board, right? So the VHA is rolling out a massive educational effort. We're talking in-person courses for thousands of clinicians, a huge online curriculum with over 40 modules, and even specialized training in things like battlefield acupuncture to manage pain. So what does all of this add up to? What's the ultimate goal of this massive cultural transformation happening inside the VHA? Well, in the end, the vision is actually both simple and profound. It's about better health for veterans, it's about getting improved clinical outcomes, and it's about creating more satisfaction for everyone involved, for the patients getting the care and for the providers delivering it. It's all about helping veterans live their fullest, healthiest lives. And that just leaves us with a final, powerful question to think about. The VHA is proving this model can work for millions of veterans. So, what if this wasn't just for veterans? What if all healthcare, for all of us, started not with our symptoms, but with that simple, profound question: what matters to you?